And there's a group of people, a very small group of people that have very serious behavioral impacts of mental illness, substance use, and acquired brain injury that absolutely require care under the Mental Health Act. And there are simply no services for those folks. So what we're doing is creating services that didn't exist. Housing services, approved home for people with this very, very severe forms of behavioral disturbances resulting from mental illness could be treated, and also mental health centers in corrections, where these patients frequently find themselves because of the previous lack of availability of services. So to clarify, we are not expanding the use of the Mental Health Act. We're going to clarify how it can be used right for the right people at the right time.
How will you ensure, or how will you measure whether this program is prudent and successful?
Because for the first time, my office has centralized access to all the provincial data. Now it's not fragmented in silos as before, but I will monitor how the unit that we're opening on remand impacts the well-being of people that are incarcerated with mental health and substance use disorder, how the approved home impacts the life course trajectory of those folks, and how the new mental health centers impact the outcomes. And I would certainly expect that we will see a decrease in the dramatic and tragic situations that we've been seeing in the past few years.
Do you see toxic drug deaths receding?
Yes.
How soon do you think?
Well, we need to. We're in a very interesting moment of political transition. Nevertheless, we have been able in 3 months to create 3 types of services that haven't been created in decades, even though many of us knew and have been saying for at least 10 years that was part of the problem. We are releasing a memo on how to apply the Mental Health Act correctly. So these things will start to happen in time. And the next legislature will hopefully support that. And we will start seeing changes in very short order.